Hello, and welcome to the video on surface anatomy of dermatome. Dermatomes are specific areas of skin that are innervated by sensory nerves originating from a single spinal nerve root. Each dermatome corresponds to a specific level of the spinal cord. These dermatomes play a vital role in the sensation and perception of touch, pain, and temperature in different parts of body. The concept of dermatomes dates back to the early 19th century, and subsequent the dermatome mapping started to shape. Keegan and Garrett map was founded in 1948. Currently, the most widely used dermatome map in American Spinal Injury Association ASIA scale of assessing spinal injury is based on Forrester map. According to both papers from Forrester and Keegan, each dermatomes have some degree of overlap with adjacent dermatomes. In this video, we will provide a brief overview of anatomical basis of each dermatome and their key examination points. Key examination point would be a point where its supply would be purely by the respective nerve root and not from any adjacent nerve roots.
We shall proceed with cervical dermatomes and their key examination point. There are 8 cervical nerve roots, but only 7 can be tested for sensory, as cervical 1 nerve root does not have a dermatome. C2 spinal nerves supply the skin over posterior aspect of head. Anteriorly, it supplies the dermatome below the border of facial dermatome supplied by mandibular branch of trigeminal nerve. Key examination point of C2 is at least 1 cm lateral to the occipital protuberance, or 3 cm behind the ear. C3 spinal nerves supply the skin over anterior neck, posterior aspect of the upper neck, head, and supraclavicular fossa. Key examination point of C3 is at supraclavicular fossa at midclavicular line. C4 spinal nerves supply the skin over shoulder and skin of the infraclavicular fossa and posterior lower neck. Key examination point of C4 is over the acromioclavicular joint. C5 spinal nerves supply the skin over lateral aspect of the upper extremities and above the elbow. Key examination point of this region is at lateral side of the antecubital fossa, proximal to elbow crease. C6 spinal nerves supply the skin over the forearm and radial side of hand anteriorly and posteriorly. Key examination point of this region is at the proximal phalanx of the thumb over dorsal surface. C7 spinal nerves supply the skin over central aspect of the dorsal and palmar surface of hand, including the middle finger. Key examination point of this region is at the proximal phalanx of the middle finger over dorsal surface. C8 spinal nerves supply the skin over medial side of the forearm, ulnar side of hand, including little finger over palmar, and dorsal surface. Key examination point of this region is at the proximal phalanx of the little finger over dorsal surface.
Thoracic spinal nerve root supplies the surface medial side of the forearm, arm, thoracic and abdominal region. Dermatomes over the thorax and abdomen are evenly distributed in a striped pattern, and they tend to dip inferiorly as they course from posterior to anterior as compared to dermatomes of the upper and lower limbs. This is due to the difference of limb developmental during early embryonic stages. Each dermatome are innervated by sensory nerves emerging from a single spinal nerve root. A therefore examination of the anterior surface was sufficient for assessment of both anterior and posterior surface.
T1 spinal nerve supply the skin extending to the medial aspect of the forearm and distal arm. Key examination point of this region is at medial side of the antecubital fossa just proximal to the medial epicondyle of the humerus. T2 spinal nerve supply the skin over medial and proximal aspect of the arm continuing into the axilla. Key examination point of this region is at the apex of the axilla. T3 spinal nerve supply the skin anteriorly and posteriorly at the level of lower axilla. Key examination point of this region is at the midclavicular line and the third intercostal space. T4 spinal nerve supply the skin anteriorly and posteriorly at the level of nipples and between fourth and fifth ribs. Key examination point of this region is at the midclavicular line and the fourth intercostal space at the levels of the nipples. T5 spinal nerve supply the skin anteriorly and posteriorly at the level just inferior to the nipple and between fifth and sixth rib. Key examination point of this region is at the midclavicular line and the fifth intercostal space located midway between the level of nipples and level of xiphisternum. T6 spinal nerve supply the skin anteriorly and posteriorly at the level of the xiphoid process and between sixth and seventh rib. Key examination point of this region is at the midclavicular line and at the level of xiphisternum. T7 spinal nerve supply evenly distributed skin anteriorly and posteriorly between dermatomes supplied by spinal nerves T6 and T8. Key examination point of this region is at the midclavicular line, 1/4 the distance between the level of xiphisternum and the level of umbilicus. T8 spinal nerve supply evenly distributed skin anteriorly and posteriorly between dermatomes supplied by spinal nerves T7 and T9. Key examination point of this region is at the midclavicular line, 1/2 the distance between the level of xiphisternum and the level of umbilicus. T9 spinal nerve supply evenly distributed skin anteriorly and posteriorly between dermatomes supplied by spinal nerves T8 and T10. Key examination point of this region is at the midclavicular line, 3/4 of the distance between the level of xiphisternum and the level of umbilicus. T10 spinal nerve supply skin anteriorly and posteriorly at the level of the umbilicus. Key examination point of this region is at the midclavicular line, located at the level of umbilicus. T11 spinal nerve supply evenly distributed skin anteriorly and posteriorly between the dermatomes supplied by spinal nerves T10 and T12. Key examination point of this region is at the midclavicular line, midway, between the level of umbilicus and the inguinal ligament. T12 spinal nerve supply skin anteriorly just superior to the pelvic girdle and posteriorly evenly distributed skin between the dermatomes supplied by spinal nerves T11 and L1. Key examination point of this region is at the midclavicular line, over the midpoint of the inguinal ligament.
Next, we shall take a look on the lumbar and sacral dermatome anatomy.
Spinal nerve L1 supplies the skin lateral to L1 vertebra posteriorly and wraps anteriorly to the groin and pelvic girdle area overlying the inguinal canal. Key examination point of this region is the point midway between the key sensory points for T12 and L2. Spinal nerve L2 supplies, anteriorly the skin covers the thigh inferior to the inguinal canal. Key examination point of this region is on the anterior medial thigh at the midpoint drawn connecting the midpoint of inguinal ligament and the medial femoral condyle. Spinal nerve L3 supplies the skin evenly spaced between dermatomes supplied by spinal nerve roots L2 and L4, extending down the medial aspect of the thigh and leg. Key examination point of this region is at the medial femoral condyle above the knee. Spinal nerve L4 supplies anteriorly the skin curves from the lateral aspect of the thigh to the medial aspect of the leg and foot, which includes the knee, medial surface of big toe, and medial malleolus. Key examination point of this region is over the medial malleolus. Spinal nerve L5 supplies posterolateral aspect of the thigh, wrapping anteriorly at the level of the knee to cover the anterolateral aspect of the leg, which includes the dorsal and plantar aspects of the foot, lateral surface of the big toe, and toes 2, 3, and 4. Key examination point of this region is over dorsum of the foot at the third metatarsal phalangeal joint. Next, sacral spinal nerve, S1, supplies skin over the sole plantar surface of toes that spreads upwards along posterior side of leg. Key examination point of this region is on the lateral aspect of the calcaneus. Spinal nerve sacral 2 supplies posterior surface of thigh and leg. Key examination point of this region is at the midpoint of the popliteal fossa. Spinal nerve sacral 3 supplies anteriorly skin over genital region respectively and posteriorly over perineal region. Key examination point of this region is at ischial tuberosity or infragluteal fold, depending on patient skin, if can be moved up, down, or laterally on the ischia. Spinal nerve sacral 4 supplies skin over perineal region, while spinal nerve sacral 5 supplies skin adjacent to the anus. Key examination point of both these spinal nerve roots, taken as a single level, is in the perineal area, less than 1 cm lateral to the mucocutaneous junction.
Next and finally, we will include face dermatome as well to complete the whole topic on dermatomes. Face sensory is supplied by the trigeminal cranial nerve, which give rise to 3 cutaneous branch, ophthalmic, maxillary, and mandibular nerve. Each branch of the trigeminal nerve supplies the face according to its distribution, and their respective key examination points can be described according to the plastic aesthetic unit and based on the surface tension lines.
Ophthalmic branch V1 of trigeminal nerve supplies skin from tip of nose to the vertex of scalp along upper eyelid and forehead. Key examination point of the nerve is at the point of intersection between superior forehead wrinkle line and midpupillary line. Maxillary branch V2 of trigeminal nerve supplies skin area from the lower eyelid to upper lip and the buccal. Key examination point of the nerve is at the point at mid-pupillary line below the lower eyelid. Mandibular branch V3 of trigeminal nerve supplies skin area from the lower lip to the lower part of the mandible and parts of the external ear excluding angle of mandible, which supplied by C1. Key examination point of the nerve is at the point at midpupillary line over body of mandible.